Well, hello and welcome to volume 152 of My Prostate is Trying to Kill Me. I'm Mark Graves, just a regular guy fighting prostate cancer, and I'm happy to have you along for the ride. Today's a special day. I told you guys about this a couple days ago, and I've been really excited about this. I have a special guest with me today, and I'll just set this up real quick as to how this came about. A friend of mine on Facebook sent me a link to an article in the Orange County Register. Julie knows I'm fighting prostate cancer, so she thought I might like to read it. I did read it. And I posted it on the thread for the cancer crew. And Jack Smith from Arizona, who's a buddy of mine, been known for a long time, says, I know this guy. And so I said, well, great. And then he gets a hold of me on Monday and he says, hey, I just talked to Dr. Gary and he would like to talk to you. So I talked to Dr. Gary and said, is there any chance that I could interview you on my channel about your work? He said, yes. And here he is, Dr. Gary Ulaner from Hoag. I've got it actually written out here. Hoag Molecular Imaging and Therapy Program in Irvine. Welcome.
Thank you, Mark. I really appreciate it, you having me around.
I cannot tell you how much I appreciate it. I know you guys are really busy and it's fantastic. So I got super excited about this article when I read it. And guys, I'll put the link in the description below so you can go to the Orange County Register and read it as well. By the way, great picture. And find out what's going on. So I'm going to let you explain where you're at, because I kind of understand it, but it would be so much better if you brought it out.
Mark, I'll do my very best to try and explain it. I like to explain it, molecular imaging and therapy, as a key fitting into a lock. Every cancer cell has targets in it or on it, and we can treat them like little locks. We can design molecules that bind to those locks, like the key fitting into the lock. And those molecules then become really important because we can use them to target the individual cancer cells. The interesting part of what I do is we take those molecules that bind to the targets, like the keys into the locks on the cancer cells, we attach radioactivity to them. Now, if we attach a small amount of radioactivity to our key, now we have something that emits this low-level radiation, not enough to harm anyone, but enough for us to see in sensitive imaging cameras, so that we can visualize, we can detect cancer at much more sensitively than virtually any other imaging modality. And this is what was talked about in that article. We have a prostate cancer imaging trial in which we can visualize a molecule on the prostate cancer cells called prostate-specific membrane antigen, and visualize prostate cancer, detect the prostate cancers far more sensitively than what are currently used methods of imaging like CT scans and bone scans.
Now, I looked at the picture here that's in the article in the Orange County Register, and it's amazing. It's like the difference between watching an old 1950s black and white TV or an 8K, high def television. It's just crazy how much more you're able to see out of this.
Well, we're still not perfect, but this really does raise the bar for prostate cancer imaging. With this technology, we can visualize tumors that are 1/10 to 1/100th the size of prior imaging methods. And as you can imagine, the smaller we can find tumors, the better you can design the treatments to treat those tumors.
Oh, that's just crazy. And speaking as a guy who has cancer, I mean, it's one of the worst things is to know that it's still there, even though you've had treatment and you're checking your PSAs and that kind of stuff. It's always in the back of your mind every day. I wonder if we got it all. I wonder, is it still there? Is it still laying dormant? Is it starting to move? Is it going to end up on my spine, my bladder or something? And with a way to image it this way, you would be able to find something that, months ago, we wouldn't have been able to see. And like you say, then you can take your course of action to figure out how to do it. How long has this been available to the public?
So it's actually still mostly available only on clinical trials. Hoag is one of a few dozen places in the country that has access to this type of imaging technology to benefit their patients. We're the first in Orange County to bring it to the Orange County community.
So we really are talking cutting edge then.
Yeah, absolutely. I fully expect that this particular PSMA imaging agent, which we call PYL, which binds to that prostate-specific membrane antigen, I think this is going to get approved most likely by the FDA this calendar year. So it will become more widely available to the public, but as of now, it's only available in a few specialized medical centers.
Okay. And a question too about, as you're talking about, you have a molecule that you attach to the cancer cells inside. I'm assuming that that's done through some sort of an injection?
Yes, sir. So we administer the PYL, this agent, into the bloodstream. And then over the course of about an hour, the molecule circulates around the bloodstream and finds its target on the prostate cancer cells, and then kind of gets removed from the bloodstream and localized within the cancer cells. If you were to image only after 5-10 minutes, you wouldn't see very much. But when you image patients in about an hour or 2 hours after you administer the agent, you get very, very good imaging of where prostate cancer cells are within the body.
Okay. And as far as the injection that we're given, it's making me think of kind of like an MRI with contrast. Is there any side effects to the fluid that you're using? I don't know what else to call it.
Very, very little. It's a what we call it's an imaging dose of the agent.
Mm-hmm.
So it's not a treatment, right, for prostate cancer. We're finding the cancer, which helps us then design the treatments. But that imaging has virtually no known side effects. We've given it to patients without a single side effect here at Hoag.
Fantastic.
I would use this opportunity then to say the second aspect of this molecular imaging and therapy. We talked about the molecular imaging, now about the molecular therapy. If we take that same molecule that binds to the prostate cancer cells, or a very similar molecule, and we take off that that thing that emits low amounts of radiation, and we attach onto it something that emits a very high amount of radiation, now we have a molecular therapy, something that we can use to deliver killing amounts of radiation right up against the prostate cancer cell. And Hoag also has a clinical trial available for patients with known metastatic prostate cancer to help provide a therapy option that previously wasn't available. So that first half, we talked about molecular imaging. Where is the cancer cell? Take off that low amount of radiation and attach something that provides a high amount of radiation. And now you have a molecule that allows you to treat the prostate cancer by what we call molecular therapy.
That is exciting. That is, I'm just picturing a dog running exactly to, where the hunter told him to go. It's like, right there is where it's at. Go get it. That's amazing. So I know you said that it's only available right now through the clinical trials. And what I'd like to do is get all the information when we're done here, and then put it a way for people to contact you guys that might be interested to see if they fit into the criteria for this. I'll post it there. So guys, if you want to go down, I'll have it listed there as a way to get a hold of Dr. Gary. You can find out what's going on. And this not only is working for prostate, but you're also doing breast and bone cancer as well, too.
Correct. By the same principle. So for prostate cancer, we're targeting that molecule called prostate-specific membrane antigen. For patients with estrogen receptor positive breast cancer, we can target the estrogen receptor to do a very similar type of imaging in patients with breast cancer. And then multiple myeloma is a tumor type that virtually all of them express a molecule that is currently known as CD38. So we have a method of imaging CD38 and imaging multiple myeloma, which, as you said, is a bone marrow tumor. So Hoag currently has these molecular imaging and therapy trials open for patients with breast cancer, prostate cancer, and multiple myeloma. Our goal is to open an entire array of molecular imaging and therapy trials over time to assist patients with a wide range of cancers.
That's fantastic. Now, the clinical trials, have they been going on for a short time now, or are you just getting started with this?
So I was recruited from Memorial Sloan Kettering Cancer Center in New York City back in September of 2020. And then it took us a few months to get our molecular imaging center up and running here at the Hoag Family Cancer Institute. We started recruiting patients in January of 2021. And now, as we said, we have the trials open for 3 malignancies with more on the way.
Oh, this is exciting. This really is exciting. Is there anything else that you'd like to add at this point?
I think that was a wonderful opportunity to discuss molecular imaging and therapy with your viewers. I really appreciate having the opportunity to do so. If there are people who are interested in more information and may want to see if they are eligible for our clinical trials, they can reach out to me. My email is my first name, Gary, Gary, period, my last name, Ulaner, Ulaner, at Hoag, HOAG.org.
And I will put that in the box below, guys, so you can click on that as well to send the mail. Now, the guys in the cancer crew, like Jack and myself and the Steves and everybody that hangs around there, we always give everything nicknames for all the stuff that we go through, the different things. So I'm thinking we're gonna call this one Seek and Destroy. It's just easier for us to remember. But this really is exciting news. And again, thank you so much, Gary, for taking the time to speak to us today. I really appreciate it. And we'll have all the information there. And hopefully some of the guys that are watching will be able to benefit from this. Plus, I'm going to ask everybody that's watching this, if you would, on your Facebook page, on all your social media, please share this and get the word out, because this is brand new. And it sounds like it's really going to help a lot of people. It's going to make a huge difference. But just like everything else, people can't use it if they don't know about it. So let's get it out there. Let's spread the word. Let's help as many people as we possibly can.
Well stated, Mark. Thank you so much for helping us do just that.
No problem at all. All right, guys, I appreciate you so much being here. And as always, if you want to follow along, click the follow button below. Give me a thumbs up so that the algorithm goes up and more people can easily find us and we can spread this. And also, too, just like I always tell you, thank you so much for the thoughts, the prayers, the good wishes, the positive vibes, the aloha, the shaka, everything you guys send my way. I appreciate it. And I'm sending it right back to you as well. So God bless you all. And I will talk to you soon. Thank you, Gary.
Thank you so much, Mark.